All right. Hello, everybody. My name is Matt Phelan, and I am the Public Policy Manager for Michigan for your Alzheimer's Association. And I'd like to welcome today to our prep video for our State Advocacy Day, which is on April 26th. And joining me today are Colin Ford, our Director of Public Policy for the Alzheimer's Association here in Michigan, and also Todd Tennis, our contract lobbyist that works with the Alzheimer's Association on our issues in downtown Kansas. Thanks, guys, for joining me. So first, I just want to go over, before I hand it to Colin and ask Todd a couple of questions, talk about their day, just a little bit of what it's going to look like. This year, our program actually starts at 10 a.m., but we have included a 9 to 10 a.m. kind of registration and networking hour for volunteers to come in early, talk to us, talk to all other volunteers, and get ready for the day. But then our morning program will start at 10 a.m. It'll run through about 11:30, 11:45. And then over the noon hour and over the 1 to 2 o'clock hour, we'll be doing our meetings with our state representatives and our state senators. We've already gone ahead and scheduled these meetings for you, so there's nothing that you need to do for this. You just need to show up. We'll have a list of all those meetings, and then we're going to go over how the issues that we're going to talk about and how to talk to those lawmakers for you. After all of our meetings are done, we're going to finish up the day at 2 o'clock in the Capitol for a short Capitol event where we're going to hand out some awards for the year and wrap up our day. So one of the things that we want to talk about today is what are we talking about when we get there? And so for that, I'm going to ask Colin kind of what are the issues, what are the main two issues that we are going to be training you on that morning. You probably have all seen fact sheets that we sent out about this, but wanted to give Colin an opportunity to talk just a little bit more depth about it. And then we'll also go into a really deep dive on it at State Advocacy Day. So Colin, take it away.
Sure, thanks, Matt. We are going to have two issues that we're going to be focusing on during Advocacy Day. Number one is our continued efforts related to funding and support for a dementia unit in Michigan. And secondly, adding neurology to the list of specialties covered by the Michigan Essential Provider Program. Related to the Michigan Dementia Unit, as you'll recall, the result of last year's Advocacy Day, one of the great developments related to that was the inclusion of $400,000 in funding for a dementia unit. That was included in Section 122 of the budget, which was the one-time funding. So now our focus is shifting away from just the ask, but making the funding permanent and then also operationalizing the program. We need to have the funding be stable so that the administration can really plan for the future. But we also need to have some recognition of where the program is going to be located and what the expectations for the program are going to be. So this year, we're going to specifically ask that the Department of Health and Human Services add dementia to the chronic disease and injury prevention section within state government. When you look at what we know about dementia, the scope and severity of the disease, the fact that it is a chronic disease, the fact that it does respond to public health interventions, it belongs in chronic injury or chronic disease and injury prevention, just like cancer, just like hypertension, just like many of the other diseases that are located there. So those are the two specific asks that we have that are more targeted related to the dementia unit this year. We feel that those are things that both the House and the Senate can get behind with tangible actions, either adding it to the budget, talking to their colleagues on the Appropriations Committee, but then also working with the administration to make the dementia unit an operational reality in Michigan. The second issue that I mentioned that we're going to be advocating for on Advocacy Day is adding neurology to the list of specialties that are covered under the Michigan Essential Provider Program. The Michigan Essential Provider Program is a program in Michigan that uses state and federal dollars to provide loan repayment and loan forgiveness for physicians and other medical health professions if they locate in underserved areas. Currently, there are several specialties that are covered: primary care, psychiatry, other non-physician specialties like dentistry and advanced practice nurses are included. Within the last year, geriatrics was included, which was one of our priorities as well. But we're still looking to have neurology added to the list of specialties that are covered for this. As I'm sure many of you know, the importance of early detection and diagnosis is absolutely crucial to Alzheimer's disease and dementia. And neurology is one of the crucial specialties in terms of making that diagnosis. We have an undersupply of physicians in Michigan generally, specifically with neurology, in a lot of areas outside of the main urban centers. And even within some of the urban centers, it's difficult to find a neurologist and to get an appointment. And so those delayed diagnoses have real world impacts. And so we want to increase the accessibility of neurology for patients in Michigan, especially those with dementia, to get a diagnosis. And adding neurology to the list of specialties covered by the Michigan Essential Provider Program is one more tool in the toolbox for the state and communities to recruit neurologists into different communities and make a dent in better detection and diagnosis of Alzheimer's and other forms of dementia. One last point about this issue that we'll talk a little bit more about next week is this doesn't cost the state any additional money. These are sort of competitive programs, projects that are available, and so communities can make the case. You know, we have an aging population. We have 0 neurologists. We should be able to access this money over, say, a community that has more physicians and other specialties that are seeking the same money. So it's a competitively bid process. So it's not taking away money. It's not adding new money. It's just simply adding an additional specialist to the list of folks that are qualified for that. So those 2 areas are going to be really where we focus our energy on. And again, we've looked at things that we're trying to make a dent in early detection and diagnosis, and then sort of the public health implications of Alzheimer's and dementia in the state of Michigan. We feel those 2 issues are good priorities for you to advocate for and help make a difference in Michigan. So with that, Matt, I'll turn it back to you, and you can advance the discussion here.
Great. Yeah, thanks, Colin. So we feel these are 2 very important issues. Obviously, almost the same, very similar to what we did last year. We had successes last year. We just kind of have to build on that. And as Colin mentioned, coming out of our State Advocacy Day last year, geriatrics was added to this program. And so we are 50% to our goal of getting geriatrics and neurology included into the program. And now we're focused on neurology. And if you look at the fact sheets that we have sent out, and I hope you will before you get the Advocacy Day, you'll see a staggering stat on the one that shows that 43 counties in Michigan don't have a single neurologist. And so those are the types of things that we're trying to address here. So with that, now I'm going to turn it over to Todd and ask Todd to talk just a little bit about what's going on in Lansing right now and kind of, you know, we have some budget asks here with the $400,000 for dementia. You know, where are we at with the budget? I guess more importantly, where are we going to be at next Tuesday on the 26th right. When we show up? So and then and kind of what's the attitude or mood right now in Lansing? Todd?
Sure. Well, right now we're in the middle of the budget process. The governor released her budget recommendations in February, and because of the partisan makeup of the governor's office, we have a Democratic governor, and then the legislature, the House and Senate are both majority Republican. So the governor's proposal is being debated, but right now where we're at in the process is the subcommittees of the House and Senate Appropriations Committees are just starting to come up with their counter proposals. And so for the last couple of months, the legislature, primarily the Republican members, have been negotiating amongst themselves on what their priorities are going to be as a counter proposal to the governor's proposal. And then over the next 2 months, potentially longer, will be the, getting down to the nitty gritty negotiations on what will go into the next year's budget and what will not go in. And the next key milestone is May 20th, when the next revenue estimating conference will happen. And this is a meeting of the Treasury staff, House and Senate fiscal agencies, where they determine what they feel the state's budget will look like, how much revenues are coming in, and that will give the legislature and the governor the bottom line of how much they can expect to be able to spend in the next fiscal year. So negotiations right now are still pretty much intra-party. The governor's office is working with primarily Democratic members of the legislature. The Republicans are working with Republican members of the legislature to come up with their counter proposals. And really, we expect this whole thing will come to a head sometime in June. So the timing of our push is very good because we're getting in right when this is the number one issue that the legislature is looking at is the budget. Regardless of who you're meeting with, whether they're a member of the Appropriations Committee or not, they are going to be interested in budget discussions. And so that's why we set this time for our lobby day, because so much of our advocacy work is around state funding and state support for dementia-related efforts. The governor's budget proposal did not include funding for a dementia unit. And we're still advocating with the executive branch, with the department itself, to try and have more of an emphasis on dementia-related issues. And we feel that this is a good way to do that, is to create a unit that's specifically focused on that. Just like as Colin said, we already have those for cancer and diabetes and other types of chronic diseases. So we think this is a very valid and viable ask. It's something the department can do without too much reconfiguration. They just did a reorganization that impacted some of these agencies, like the Aging and Adult Services Agency, which is now called the Health and I should have had my crib notes with me, but there's a new entity that the Aging Services and Medicaid offices have been combined. So, this is, we're at a point where all these issues are being decided. And so this is an excellent time for lawmakers and policymakers to hear from their constituents. And that's why it's so valuable to have all of you who will be coming to Lansing and flying the colors and making people aware, making policymakers aware of how important this issue is. So that's kind of the state of affairs in Lansing right now.
Great, thanks, Todd. So yeah, as Todd mentioned, we're showing up at a very good time. We're right in the middle of all these negotiations that are happening. We're going to talk about our issues. So we look forward to seeing you on the 26th. Please come. Be prepared to tell your story. That's really what moves these lawmakers. Todd, Colin, and I can hand them as many statistics and can go meet with them as many times as we possibly can, but there's not quite the impact as having an actual constituent of theirs sit across from them and tell their personal story of how Alzheimer's and dementia has affected them on a day-to-day basis. Most of our legislators don't know the true effects of this disease and how it affects families on a day-to-day basis. So please come prepared to tell your story. You're the expert on your story, and we look forward to hearing those stories next week. And we look to have a great day on April 26th. So thanks for watching this preview of the day, and we will see you in Lansing.